So our reassessment on our neuro patients, we definitely want to be considering our low blood sugar and things like that. As you know what your dosage of your D50 is in the field. Most often it's 25 grams. The book says that you can give 12.5 to 25 grams. In most situations it's going to call for a full amp of D50. We're not able to get IV access, and we're going to do 1 milligram of glucagon, right? I am. You got to be very careful with dextrose-containing fluids because it can add to increasing intracranial pressure. So that's why they say when you give fluids, just give isotonic solutions, which won't be an issue with you guys, but in some areas they may use D5W. And so if they're unresponsive and you believe it's due to a head injury, then you may want to give half your dose of D50. Be sure that you keep a close eye on your airway, because as time goes by, then they may start losing the ability to keep it open. With trismus, we talked about it just a minute ago. It was involuntary clenching of teeth. If they're having airway issues, these patients may end up being candidates for RSI. If it's clenched so bad that they can't breathe, and that's something that you'll often run into. Any of y'all flew out a head injury patient that they had to RSI on the scene yet? Where they clenched down whenever they tried to start intubating them? Very, very common. If you know, for whatever reason paralytics are unavailable, you could do a needle crike. However, I don't figure that your airway or your EMS system is going to allow you to do a needle crike but not allow you to do a RSI. Narcan, opiate overdose, if that's why they're unresponsive, remember we give Narcan not necessarily to wake them back up, but to do what? Increase respiratory drive. Now, I don't know why they just included rectal administration of diazepam. You can give diazepam rectally. As a matter of fact, it's what is indicated in pediatric patients. The dosage for the rectal administration is 0.2 milligrams per kilogram. How do you give it? Well, obviously, you wouldn't give something rectal by the mouth. What? Yeah. Yeah, it would. How do you give it? Do you just take a needle and push it up there? You remove the needle. You take an IV catheter. You put the plastic sheath of the IV catheter on the end of a syringe. You draw up your dosage. You slide just the catheter up into their rectum. Don't nearly kill them. Rectum nearly killed him. Then you inject. Now what do you got to do? You got to keep it from coming out, right? How do you keep it from coming out? You do a squeeze. Do a squeeze. Hold the buttocks together for 5 minutes. It's really not that big of a deal. Never ran into a situation where I had to give an adult rectal benzo. Alright? I have in kids. I have one kid in particular I remember that had a seizure that I had to do that for. But not an adult. Usually we will give what? IV, right? What is the accepted dose of IV diazepam? 5 to 10, right? What is another benzo that might be available? Ativan or lorazepam. You know the dose of it? 1 to 2 milligrams. Does anybody service carry Ativan? Y'all carry Ativan? Do y'all carry Valium too? Huh? You do? So we've talked a lot about the information that we need to document and to communicate for neuro. You can go back and look at a lot of this too. All right. Common neuro emergencies. Most of them are caused by more than one factor. With children, oftentimes you may have issues with development and may have had some type of anoxic injury as they were being born. The effectiveness of the body's defense and repair functions, are they immunocompromised? Or you could have exposure, as in the case of the infectious disease stuff. So this is what I